Welcome to May I Hold Your Hand. I'm Nurse Tash, and I'm going to take great care of you today. This is my Pregnancy by Week series where I teach what is happening in your body with each week of pregnancy. Last week was week 23, so if you missed it, feel free to pause here and go back to take a listen. Now we're at week 24. Yay! Your baby is about the size of an ear of corn and is now considered viable. This means that your baby could survive outside of the womb with medical assistance. And while it may be an uphill battle from here, the likelihood of your baby surviving is greatly increased once you reach 24 weeks gestation. Your baby's lungs are continuing to develop and their air sacs are beginning to produce surfactant, which will help the baby breathe after birth. The baby is developing more complex immune functions as well, and their nervous system is becoming more developed. The baby can now control some of their movements and respond to external stimuli. Their skin is becoming less wrinkled as more fat accumulates underneath. The baby's ears are now fully formed and they can hear more sounds outside the womb. How are you? Well, your uterus, of course, is continuing to expand and you're going to be feeling some stronger movements from the baby. You may experience Braxton Hicks contractions more frequently, and these are like practice contractions. They can happen infrequently but don't necessarily indicate that labor has started. You may experience more fatigue or be more tired due to the extra weight that you're carrying and the changes in hormone levels. You may also start to have some trouble sleeping due to discomfort from your growing body and just general restlessness. A great way to manage this would be to incorporate a mindfulness routine. Shameless plug, I've already recorded a few tracks of affirmations and guided meditations that will induce calm and release any anxiety, leading to a more pleasant and peaceful night's rest. You may also experience increased vaginal discharge due to your hormonal changes. It is important for you to continue taking care of yourself during this time by eating a healthful diet, staying hydrated, and getting regular activity. You should attend prenatal appointments and discuss any concerns or questions with your healthcare provider. Understand that your healthcare provider may be recommending some prenatal screenings, tests, or anatomy ultrasounds to check on the baby's growth and development to ensure all is going well. You may also start to think about creating a birth plan, preparing for labor and delivery. Talk these things over with your support people so that they know what your wishes are going into your birthing season. Creating a birth plan in your mind helps to decrease some anxiety, but also can serve as a teaching tool as you research and look up what your options may be. It also gives you time to discuss these things with your provider so that you're all on the same page. Thank you for joining me for this week's Pregnancy by Week series. The next week is week 25, so be sure to come back and learn what's happening. As a reminder, this is not a substitute for medical advice or professional health care. So if you suspect that you may be pregnant, contact a licensed obstetric care provider so that you're able to get the care and attention you deserve. Bye-bye now.